Hi, Caroline. How are you?
I'm good, thanks. I am in Ashgrove House this morning in Forester Hill, so I have less control over this environment than others. So I'm hoping that we'll get through this conversation without any interruptions, but we'll see. How are you?
Yeah, I'm good, thanks. Had a little bit of annual leave off over the Easter weekend, but glad to be back in the fray.
Good.
You know,
Detoxing from your chocolate.
exactly, very much so. So it's always a bit nerve-wracking doing these things. I guess I think by my count, this is the third one of these Ask Caroline sessions that I've been asked to do. So, but on the basis you keep inviting me back, I'm sure it's probably not as nerve-wracking for me as it is for you, Caroline, since you're the one that gets asked the questions.
Yeah, I mean, I think it's good. It keeps me on my toes, and I think I'll definitely pull you into any of the difficult questions. So no, it's good, and I mean, I think the approach of just trying to have a conversation and the fact that we're doing it in that way, and I don't have bespoke scripted answers is part of the thing. I think so. So yeah, that's we'll see how it goes.
Ah.
And there's my first interruption. Give me the reality of doing this. Tom Power.
Hello, Tom.
Hi, folks.
Welcome,
Nice to see
welcome to
you.
the live Ask Caroline session.
You're in the Q&A now.
That's what's called hybrid and remote and agile working, isn't it? I think. Well, I hope you're having an enjoyable Q&A. I think I'll probably leave before I get asked any more questions.
Yes, good idea. See you later.
It's quite tempting, isn't it? Yeah.
There you are. So we'll see how it goes.
Yeah. I look forward to seeing the edit now. I'm going to be curious how you splice it together, mate. Okay. So yeah, I guess we're now into the monthly schedule that's been published, and so I hope for the colleagues that are you've been watching this that you've all now seen the published dates that are now in place for the next year or so. I guess we've also quite a few updates in the daily brief in the past couple of weeks with some of the responses to last month's questions. For those that didn't see them, please bear with me for a minute or two, as we thought it was worthwhile providing a quick summary. However, if you did see it, feel free to use the chapter link to skip forward. It sounds all very high tech. So in terms of the updates, motorbike parking at Forester Hill, there's been confirmation that this will be included in the upcoming car parking review. The bike lockers utilisation, the teams are investigating the extent to which lockers are allocated but not used and will update via the daily brief in the next few weeks. They have confirmed that there's currently no waiting list for these lockers, which I guess is good news. The quest for more bike sheds, this will be considered at a future NHS Grampian transportation oversight group. Paul Allen, our Director of Infrastructure, did point out that, as always, this will have to be subject to the available funding. And in terms of pay slips, information has been shared explaining the codes on your pay slip, so hopefully makes that a little bit easier to understand, as well as information on how to sign up for the electronic versions. The team involved are also working on a longer-term solution to get people moved over, and hopefully we'll have an update by the midsummer on that. So it's good to see updates coming through regularly now, and hopefully it continues to be useful for people. Anything else that you would like people to be aware of, Caroline?
I don't think so. Just that we're working hard to make sure we close the loop on all the questions. So if we don't, then get back in touch with us. It's just about a volume and capacity thing, but we're trying really hard to get the process around it. And hopefully now that we've gone to monthly, that'll be easier to manage. But if we've dropped the ball on something, which we will, then just get in touch.
Yeah, no, that's great. Thanks, Caroline. I think I've got a note here. I think was there an update on work experience to be given? I think something relatively hot off the press. So it's not yet appeared in the daily brief, but it relates to a question that a Matthew Newman had asked previously about work experience post-pandemic. So apparently Jerry Laurie, the head of workforce, has confirmed we're now in a position to begin those placements again. So hopefully that'll be welcome news to both Matthew, who asked the question, but also across the whole system. So
yeah, I remember that question being asked actually. So that's good that we've got that.
Yeah. Thanks, Caroline. So anyway, on to this month's questions, the real reason that we're here. So question 1 is from Kyle Sim, who's one of our security officers. And he says, "Hi, Caroline. I would like to know if anyone at senior level has thought about implementing a rapid report form for sexual harassment in the workplace. I feel this would be very beneficial for all employees, especially those who don't have the confidence to report incidents or can't or don't want to submit a DATEX for certain reasons."
Yeah, thanks, Kyle, for the question. Really important topic, and so important, I think, that we provide multiple opportunities to identify and report issues and make that as easy as possible. And so the really important piece around this is that we raise the awareness of it, we talk about it, and we identify and understand the scale of the challenge. So I know that Liz Howarth is going to take forward this specific ask around the process that you're describing. I think we've done that I know we've done that in other areas with good success. So we'll definitely take that suggestion forward. Thank you for making it. And in addition to that, I would just encourage anyone that's experiencing personally or observing sexual harassment that you choose a reporting mechanism that meets your needs. That can be confidential contacts, that can be DATEX, that can be speaking to the HR hub, that can be speaking to your partnership support, that can be speaking to your line manager. But let's make sure we raise issues, we talk about it, we raise the profile and understanding of it to allow us to stand side by side with anyone that is experiencing sexual harassment and ensure that it is not part of the culture that people experience in NHS Grampian.
Yeah, thanks, Caroline. Yeah, I would entirely agree. It's important that colleagues know who they can, how to access support, and not every method will necessarily be suitable or for every situation. So yeah, a good question and a good suggestion from Kyle. So it'll be interesting to see how that progresses going forward. Okay, the next question is from a Sarah Walker, who's a surgical admin colleague, I believe, and she says, "Following episode 17 of Ask Caroline and the discussion around the Lady Helen Car Parking Centre and staff parking in a non-staff space, I wanted to ask about parent and child spaces and whether they were going to become available in the Lady Helen Parking Centre. Ever since I had to use the car park when my son was a baby in 2019 and then subsequently in 2020, it was highly stressful trying to park in a regular parking space with no extra room to get things out that normal parent and child space would allow, pram, etc. The parking down at the Children's Hospital is minimal, therefore patients have to use the Lady Helen Parking Centre instead for attending appointments down there. And I'm unsure as to why parent and children spaces were never thought of when the car park was built."
Really good question. Stephen, sorry, I didn't catch the colleague's name.
Sarah Walker.
Sarah, thanks for the question. And I'm sorry that's been your experience. I'm not actually clear on the number of child and parent in car parking spaces. However, you are absolutely correct that we should be providing that suitable space. I can say that as a new grandmother trying to manoeuvre anything in and out of the car with children is a real challenge. So I think that this is an issue that we should raise through, and I'm just thinking it would be Ted Reid that we would do that through the Transport Operational Group, which I imagine is a very busy group. So in light of the Baird, in light of what you've raised around RACH and the absence of these spaces in the Lady Helen Car Park, let's get that on the agenda of the Transport Operational Group and understand what the provision is and what their thinking is around it. Clearly, the implications of that are that to create bigger spaces, you reduce the number of spaces. However, I don't think that should be a reason not to do the right thing. So if Ted could hopefully, when listening to this, can just pick this up and get it into the group, and if there is anything specific, Ted may reach out to you for that further information. But thanks for raising the issue.
Yeah, thanks, Caroline. So on the issue of car parking, and I guess following the question and answers that we discussed in episode 17, Bruce from the car parking team got in touch because I think the phrase trust your colleagues that been used sort of last month about the use of car parking spaces by staff. Sort of prompted Bruce to get in touch, to advise that he would like to ask how the car parking team should deal with the fact that, he claims that every single patient-only parking spot at the Rotunda entrance to Aberdeen Royal Infirmary is filled with staff every day. As a result, there's no parking for patients all day, which obviously has a knock-on impact on the patient experience, and can make them late for appointments. Apparently, he continues, it's only slightly better at the maternity hospital, where about 90% of the spaces are filled by staff vehicles. Car parking staff were gutted to hear the comments that we made last month. Given what they report is going on. So he was unsure how to phrase the question, but I guess he was just wanting to sort of raise the concerns and perhaps bring a counterpoint to the trust your colleagues remarks from last month. I don't know how we should respond, Caroline.
Thanks for, despite your thoughtfulness about how to construct that question, it doesn't matter. I think it's an important thing to come back on. So thanks for having the courage to do that, Bruce. And of course, my answers aren't meant to generate colleagues feeling gutted. If I recall, and I am taxing my brain here, this was specifically about when our colleagues are attending the Forester Hill campus as patients, and we'd been contacted by one such colleague who thought it was inappropriate and unfair to ask them to go up to level 6, isn't it? Level 6. So my response to that was, let's trust our colleagues to do the right thing on this. And despite the reference to this making our colleagues in the car parking team feel gutted, I think that is the only option, because we have to be able to ensure that we are treating people that use our facilities to receive healthcare, whether they're staff or whether they are not staff. We have to treat them as members of the public, even if they work for NHS Grampian. However, I can understand and empathise with Bruce and his colleagues' position, because if I was in his role every day trying to do a task that feels impossible because of what he is describing, then there is a shift needs to happen. If what Bruce is describing, that we have no patient car parking spaces outside the rotunda or maternity because colleagues are using those car parking spaces inappropriately, then we need to find a way to address that. Now, I say that in the context of the frustration and acknowledging how difficult it is for colleagues who need to get parked. So car parking is a contentious, ever thus issue for us. I don't believe we will ever have enough car parking spaces to meet the needs of everyone. So we have to do the best we possibly can in regards to car parking. Now, there is the car parking review that Ted's going to love me after this Q&A, that Ted Reid is chairing, I believe. And Ted's the head of logistics, for anybody that hasn't met Ted. And the timeline around that, actually, Stephen, you might know more about this than me. It was deferred because the timing wasn't felt to be right to undertake the car parking review due to the number of pressures that were in the system. And so I think that conversations have continued despite not progressing, that the work has continued in the background. And I think there's an update coming to GAPF soon around where we're at with that car parking review. And thereafter, because of the level of interest, it will go into the daily brief. So I think this is the nub of it. We have to undertake this review. Now, the review is specific about creating staff car parking, I believe. I can't. There's a few things that were in the kind of principles of it. So one was about environmental sustainability. One was about safe and equitable car parking for colleagues, ensuring that we do protect spaces for patients and visitors. So that would pick up Bruce's point. And of course, it has to be cost effective to maintain, to run. So I think that's our solution there. I do think that the reference to trusting your colleagues to do the right thing, that's my overarching principle in most things. So it still remains just, but I acknowledge the frustration. I acknowledge that we've not got it right just now. And I absolutely can see the point of the car parking team when day in and day out, they'll be trying to do a job that will feel like Mission Impossible, I'm sure, at the moment. So car parking review, not sure when it's going to take place. Everything's kind of there to move it forward. However that is, whatever the outcome of that is, I'm sure we will have another suite of questions around what that has raised. But what I can commit to is that I know colleagues will do their absolute best to make the best use of the assets we've got. So hopefully that's helpful. And Bruce, I am more than happy to come and have a conversation with you and your team. If that would be useful, just drop me an email.
That's great. Yep. Thanks, Caroline. As you said at the start of that answer, it was ever thus, and I suspect it will always be thus in terms of car parking just causes controversy no matter which perspective or how many perspectives you try and cover. So thank you. A different type of question now from a David Pithie, who's another member of the security team. And David asks, do you think the system that is in place for staff members being sick and going to half pay then to no pay is a fair and just system? Is there any process whereby this can be looked at and maybe illness tiered as to having a priority over others? That is to say, do you think that it is fair that an employee of NHS Grampian who is off sick with cancer should be in half pay or no pay whilst they undergo treatment or are awaiting surgery and convalescence? Does this convey to the staff member that they are still worthwhile and being looked after by the organisation that they also work for?
Really difficult questions. Was it David?
Yeah.
Yeah, really, thanks for getting in touch, David. Really difficult question, or, well, not difficult question, but difficult to get this right. And so it's awful for anybody to have to be absent from work, even for a short period of time. And particularly when that is dealing with a very serious and enduring illness, difficult for them, difficult for their families, and of course difficult for their friends and colleagues as well. So the distress, I absolutely recognise that, and anyone who is off requires to get the right support to support them to come back to work well as soon as their health allows. And again, particularly, you mentioned cancer, so particularly in relation to really serious illnesses. And I think our occupational health colleagues, as well as line managers, and of course the support that you get from your friends and peers, all play a vital role in that. And then to your question of, do I think it's fair? So the sickness absence payments, etc., are all negotiated nationally through the national infrastructure around terms and conditions. That's for all colleagues that are on Agenda for Change, also for doctors and dentists, and the executive management pay scale. So they're the kind of three main pay T's and C's that we deal with. And as difficult as this is to hear, and I'm not diminishing the importance of what you're raising, I actually do think it's quite generous when you compare it to statutory sick pay and other industries. However, that doesn't take away from the fact that when you go on to half pay and you still have to pay the bills, particularly in this current economic climate, it's awful. It's really hard. So I think that in trying to draw a line, in trying to understand what's the right thing to do, everything we do around individuals should be as person-centred as possible. The reason that we have to go through national T's and C's, or the reason we go through national T's and C's, is to avoid exactly the things that you're raising, which is fairness and equity. And my discomfort with having a tiered approach to different illnesses would be, how do you do that? How do you do that and remain consistent and fair to all colleagues? So I recognise, David, that will not be the answer you want to hear. However, I think that the care that people receive, the support that people receive, should absolutely be person-centred. The T's and C's are set to allow us to do our best in being fair and consistent.
Yeah, thanks, Caroline. Yeah, I would agree. It'll be a very difficult situation for David and whoever it is that's going through your sort of cancer treatment and everything else. So yeah, it's a difficult one. But thank you for your answer. Okay, next question seems to be anonymous, and I think we've had, there have been several colleagues, I think, who have got in touch with corporate communications expressing frustration and asking whether there is any update on staff gyms. There's appreciation that the site for the gym at Aberdeen Royal Infirmary is now being used for something else, and relocating it might take some time, but most of the questions relate to gyms on other sites, including, I think, Woodend and Summerfield. Caroline, can you give us an update, or can you request an update or a decision on when they will ever return?
Yeah, I am going to request an update now. A bit of an update that I know is that Nigel Firth, after many years of service, has retired, and Nigel was leading on this work. And I think it was going through the sports committee, but I might have got that wrong. So let's not. So anyway, the colleague who has taken this on, and I'm not quite sure he appreciates the level of interest around this, but maybe he does, is James Norman. So I'm going to speak specifically to James. Because of the level of interest around this, we need to get to a decision point. And so I will commit to having an update in the brief, having had a conversation with James to see exactly where we're at, exactly what the challenges or dichotomies are that we're trying to work through, and when we will get the next update. Or maybe get Mike to help me to make sure that gets into the brief before the next Q&A.
Okay, that's great. Thank you.
And I think that's the first anonymous one we've had today, isn't it?
Yes, it is.
That's good. That's progress.
Yes, indeed. Coincidentally, the next issue has been raised by three different colleagues. So I guess I think it's anonymous because it's okay. Three different colleagues. But three different colleagues have been in touch about the eESS Manager self-service system. Most are talking about the issues with getting replies to emails, looking for support when issues crop up, and the impact that this is having on teams across our organisation. One colleague also highlighted an example of one of their staff not being paid on time due to these delays. Are you aware of the issues, Caroline, and is there anything being done about it?
Yeah, so I am aware of the issues. Actually, it is on my radar, and I'm aware. So I'll start off with I'm aware that colleagues were not paid on time, and in any organisation that is not where you want to be. So I apologise that that was the case, and presume that that has been rectified. I think it was beyond one colleague, actually, although it's only one colleague that's been raising it here. There were many colleagues. So I know that Lorraine Hunter, who we've mentioned before, takes such pride in how well they do their work. So that team are also frustrated. So I apologise to those colleagues that we've not got that right for, and assume that that has been rectified. eESS is a national system that we have implemented, and there are a number of issues that I know Lorraine and the eESS team fully recognise the frustration and the strength of that frustration from within the system. So I think, to be fair, they are a very, very small team. And they are, in fact, I think Lorraine put something in the brief last night around this, although I haven't read yesterday's brief yet. So they are working really hard. They're trying to prioritise as much as they can the calls, and to engage with you around issues that you're experiencing, which I believe can be as easily caused as one part of the data not being filled in, or not having a NHS Scot email address. So I am aware of it. I apologise for the frustration, and I apologise again for those that weren't paid. I know that Lorraine and the team are working really hard to address the issues. They are a small team, very small team, and appreciate your continued patience with this. It's been more of a challenge. We recognised it as a national system, which had to be implemented. We recognised it was going to be challenging, and but probably not quite as challenging as this.
Okay, thanks, Caroline. Okay, we've got our next question is from Colin McNaughton, who's one of the joiners who works in estates. So Colin is asking, what is happening to the cafe at the dental school? The charity cafe, I think that's the RVS, at the maternity hospital will be closed and is not going to the Bayard Family Hospital when that opens. Colin believes they will be doing, the RVS will be providing trolleys around the ARI wards. Is it possible for the RVS charity cafe in the Matty Hospital to be moved over to the dental school cafe instead? This would make it the only cafe on the East End, buildings that aren't ARI, and would be good for lots of staff as well as public when they come in for their appointments.
Okay, so again, a recurring theme, isn't it? The catering facilities that we can provide. So if Colin is cited on the previous Q&As around catering, you'll know it's not quite as straightforward as any of us would like it. However, we absolutely have to have catering for colleagues, for patients, for visitors across our sites. And as you will know from my previous Q&As and the responses that we got from Eleanor, who's head of catering, and Chantal, that they recognise the importance of this too. However, as financially viable catering services, we're really struggling actually around how to achieve that. But I think this is a positive update, which is that Eleanor, on the back of all of that, Eleanor and Chantal have been working with our third sector contacts and are just about to go out to, so this would be like third sector, social enterprises, those sort of coalitions of people, to tender for a 3-year contract for different catering parts across our sites. And so that will be the solution. for us, for the dental hospital, for other areas. I think that's a really, really positive step forward. And that would be around, you might have heard me, and you'll definitely have seen in the plan for the future, our intention around being an anchor, in a positive anchor institution. So that just means being a big employer in the north, being one that actually supports the local economy, the local population. So if we are using social enterprises, third sector, to deliver our catering, that's a huge benefit beyond just the function of delivering catering. So I'm really excited about that. I'm delighted that Eleanor and Chantal have moved it along in that way, and allowing us to have something different, like a third sector or a social enterprise. So social enterprise is a group of people, not colleagues, a group of people from the community that choose to undertake this and do this work together. Now, clearly there's standards and there's all the kind of things that people will need to be able to demonstrate, achieve, but that'll be what the tendering process make sure that we do. Specifically about the MATI, so that will be right around that cafe closing. I'm not aware that a definitive decision has been made on who or what will be contracted in to provide catering in the Beard or the Anchor, and I would imagine, although haven't discussed this with Eleanor or Chantal, but I would imagine that if this approach works that I've just described, then why would we not be using that as our way forward? So watch this space, but hopefully we will see a shift in that pretty soon. And I'm sure Chantal and Eleanor will put an update in the brief, just because it's such a good news story.
That's great. Yeah, thanks, Caroline. We look forward to hearing about that in due course. Okay, so next question is from Michael Sharp, who's one of our consultant vascular surgeons. Michael's been in touch to ask on behalf of his directorate about interventional radiology. He mentions that it is a specialty that is relatively new and highly technology driven. NHS Grampian has been behind the curve for at least 15 years from what he's witnessed since working here, although NHS Grampian has recently completed an update and refurb of SP2, which is the second interventional suite, costing over £1 million. Why has the board turned down the business plan to staff this area with radiographers and nurses? He goes on to say that in his view, the lack of capacity is almost certainly harming patients.
Yeah, thanks for getting in touch, Michael. Sorry, was it Mike or Michael?
Michael.
Michael, thanks for getting in touch. So IR absolutely recognise interventional radiology is a critically important service. It is now, and it's just going to become more so, I think, in the future model of healthcare. And I would agree that we're behind the curve on this, actually, as I'm sure you're not surprised to hear. So I'm not aware of the business case, and sometimes people make reference to the board and things in different ways. So I believe pre-pandemic there may have been business cases brought forward that have been turned down, but I'm not so familiar with that. What I do know is that Paul Baku, who obviously you will know as a fellow vascular surgeon, but also as the medical director for acute and the portfolio executive lead for, and the portfolio is simply the name given to what was previously the surgical division and clinical support services. So Paul is the executive lead, so all that means is the member on my team that covers this. And I know from conversations with Paul that he is working through now what we need to do to ensure that we have the right infrastructure about being able to deliver tertiary and secondary specialist services. So that would obviously include IR. And we cannot be in a position where we have a state-of-the-art theatre and no workforce to deliver any interventions in it. None of this is straightforward because there are multiple cases such as this. And when I made reference to being behind the curve earlier, that's for no other reason than the reasons that you'll be familiar with working in the service, Michael, but also the constant balance of finance and how you can best spend that. But my words of hope, my words of optimism would be that with you and with the leadership team in Paul's portfolio, there is an absolute need, and work is starting around what are the key kind of foundations that we need to have in place to make sure that we can deliver reliably and sustainably high quality and safe clinical services. IR is definitely on that list. And we're also working on a backdrop of years of non-recurring funding. So non-recurring funding simply being funding that we just get 1 year and then we don't know if it's coming the next year. That has not helped us to create a sustainable in-house workforce. And the other interesting thing, so why on earth would we have spent over £1 million on a theatre and not had a plan around the revenue for the workforce? So the simple answer to that is the kind of way in which we receive capital money and the way in which we receive revenue money are different. And when there is an opportunity to receive capital, then sometimes you have to make a decision to say, are we going to do that? Or because we don't have the workforce, are we not going to take the capital money? And I think that that's why we have ended up in that place. So we've got a state-of-the-art theatre. We now need to get the revenue to ensure we've got the appropriate workforce. And I am hopeful that, as well as the other priority things that you and your colleagues will be raising with Paul and the team, we will get to a solution for that as soon as possible.
Okay, thanks again. Okay, so next question. This is this is from a Sonja Wright, and it harks back to, I think, something that we touched on in the last Ask Caroline session about the Moodle issues with Robert Gordon University, and the challenges that colleagues have got in accessing that system through NHS Grampian's networked computers. So Sonja's asking, can we highlight to Caroline that colleagues used to be able to access the RGU Moodle before the COVID pandemic? The recent changes affect their biomedical science placement students when completing aspects of their registration portfolios and the staff supporting them. So, for example, Sonja has to mark exam papers at home or have paper copies sent up for the biomedical science course that she supports. Colleagues and ourselves find it incredibly frustrating, and it paints us as not being as fully, they're not a fully engaged partner in the training of future healthcare professionals, clearly, within an area that we so dearly require. Whilst Sonja appreciates IT have concerns, she really thinks a solution needs to be found, considering RGU are such a key stakeholder in the training of healthcare professionals for NHS Grampian. And I gather that Paul Allen has flagged this to Neil Gordon, but suspected with security issues, as the site is open source, which I'm not sure what that means, but hopefully others do. So,
yeah. So, thanks, Sonja, and we did raise this with Neil, and Neil has come back. So, I think that, as ever, these decisions are taken with the best of intention. Helpfully, Neil has come back to say there are no IT security issues with this. It's an information governance issue. And the decision actually wasn't taken by our IT colleagues. It was taken by our educational recovery group, who I think was or is either chaired by Nick Fluck, who's our medical director, or June Brown, who's our executive nurse director. So, Sonja, I'm going to ask that you pick this up with just drop Nick or June an email and perhaps share with them the implications and consequences of it. I'm not suggesting that will mean they will change it, but to make sure that they are cited on the risks. The the only other quick fix to this, obviously, is if you're using stuff on site, then it has to be a personal device and it has to be your own. But my suggestion is, now that we've got the clarity that this is not a cybersecurity IT issue, it's an information governance issue, which you'll appreciate is different, and clarity on where the decision was made, then if you take it to that educational recovery group, which is professionally driven, and the whole intention is to make education as effective. So the issues that you're raising as a consequence, that's exactly what the group is trying to improve, is our educational contribution as an organisation. So I think they'll be genuinely interested to hear this and to work through this with you. So hopefully that's a good signpost to where next.
Okay. Thanks, Caroline. It sounds like potentially some good news on that. So, we'll be interested to see how that develops. So I think we've got three questions left. So next one is from an anonymous colleague, and they're asking about Christmas and New Year annual leave. Over the last few years at NHS Grampian, this colleague's been told that employees in their area may not have any annual leave, over Christmas and New Year. This decision does not make sense to the colleague. The person goes on to say that the excuse is, how could we keep track if staff change jobs? Surely this would be relatively straightforward on SSTS. Second reason given is fairness. Again, this in the colleague's view, this is straightforward and could be managed, and staff could take it turnabout. In different years. Seems strange that the wards are fully staffed over this period when a lot of the wards are trying to get the patients home to be with family over the festive period. So, how do you respond?
So thank you for raising that. I was going to say leave over Christmas is nearly as contentious as car parks, and maybe on an equal footing with offices. So I understand how difficult it is not to get time off with your family at Christmas. Having done it for over 30 years, it's difficult, and it's as I say, a hot topic, usually in most, particularly clinical and support services. So I think I've answered questions around this before, so I hope my answer is consistent, which is, in the interests of trying to achieve fairness and equity, then this is a decision that is devolved to local teams through their line managers to agree what is the appropriate way to do this. I'm actually a little bit confused about the rationale that was given for keeping track of people as they change jobs, and I'm not sure that is a just rationale, actually. But the real from my perspective, would be, in order, of course, where possible, we should try to give colleagues a period of annual leave over this time. And in the interests of trying to give everyone some annual leave, that has usually taken us to a place of not letting anyone book block annual leave, but the line manager then trying to manage that. And I do not want to go back to those days where I was having to do that with clinical teams, because it's difficult, and you want to do the best and you want to be fair. So as an organisational position, and clearly, Stephen, you will come in on this as our employee director if I get anything remotely wrong, our position would be to try to support annual leave fairly and equitably over this period of time. Of course, local teams know what the usual demand profile looks like for their service at this time, and will make the best decisions around that. If there is something that you fear you are not being treated fairly, or that the system that you are experiencing is not similar to systems that your colleagues are experiencing across the organisation, again, then I assume you've spoken to your line manager, and if that hasn't got traction, then using the HR hub or speaking to your partnership rep would be the next step. But it's a difficult one, and we do have, Stephen, you might just be able to share a little bit more information around this, but we do have a subgroup of GAPF that focuses on terms and conditions. And they put out an annual update around Christmas leave and the kind of organisational expectations. Is that right?
Yeah, thanks, Colin. For the avoidance of doubt, I wouldn't disagree with anything you've said, so far, in this answer. But in terms of the guidance around public holidays, that the terms and conditions subgroup produce, and on behalf of Grampian Area Partnership Forum, make sure it's communicated widely within the system. Your colleagues, if they sort of look back and look at things historically, then actually there is very much a sort of pattern to the guidance that goes out, but it's around the management of the public holidays, because clearly it's linked to terms, it's linked to agenda for change or medical and dental terms and conditions again, which of course are sort of set nationally, but the guidance is really clear. And so, as you've said, organisationally, there's no reason that any employee can't request annual leave at a time that they would like to take the annual leave, but the decision making is devolved, to local managers who know the area. So depending on the bit of the system, depending on, and it can vary, year to year, depending on the number of vacancies that a team has or whatever else. It's the balance between giving colleagues, the valuable and incredibly important time off, for them, but balancing that against delivering the service. So I hope that for the anonymous colleague that provides some assurance. And as you've said, Caroline, there are options and methods there that that colleague or any others that feel they're being treated unfairly, can use to progress that. So, okay. Next question is from Heidi Taylor, and Heidi is asking: Has there been a review on the use of face masks? I imagine within sort of clinical settings. When are we going to be able to stop wearing them? And if that's not going to be soon, then why is that?
Thanks, Heidi. So I feel we get asked this question every time, and I think that's because it is really important to colleagues. And so, hopefully, again, my answer is consistent. The wearing of face masks, like all of our infection prevention and control measures, are based on the guidance that is set out from Public Health Scotland and RHI. So that's where all of our infection prevention control guidance is generated from, and obviously face masks are part of that. As I understand it, there's been no change at the moment to that national guidance. We are still wearing face masks in clinical environments, and that would be hospitals, hospital corridors, obviously the exception when you're sitting, eating and drinking, but when you enter onto a hospital site, you are expected to wear a face mask. I believe that there is an updated position that is due to be shared at the end of April. I don't know what that will look like at the moment, and what I can assure you is that the infection prevention control team are absolutely on this, because they know how important it is, and as soon as we get any shift in the guidance, it will go in the daily brief. The one thing I will say is just to remind colleagues that we do have a significant increase in COVID at the moment, and therefore the wearing of these masks it remains critically important to the safety of our patients and of our colleagues. So recognise the frustration, recognise the discomfort and the kind of negative sides of face mask wearing, but also recognise the benefits, and but assure you that as soon as there is national guidance that changes, you will be briefed on it. Even the guidance that comes out at the end of April If there's no change, I'm sure June Brown, who's the Executive Nurse Director and our lead for infection prevention and control, will get something into the daily brief to let you know that that's out there.
Okay, thanks again. So last question for today is from another anonymous colleague who's asking, and it's about car parking again. Would there be any room for staff disabled parking spaces behind the maternity hospital? They realise there's disabled parking at the front, but this colleague prefers to leave those for patients. And there are 3 spaces at the staff entrance, which would be ideal for this purpose.
So I welcome the fact that this colleague is saying they'd prefer to leave the access to disabled parking to patients. However, as I understand it, which could be wrong, so as Ted's going to feature in this large, then I'm sure he'll come back and tell me I've got this wrong. I don't think we distinguish or differentiate who uses disabled car parking. I strongly believe that all colleagues that have a disability should have appropriate access. So I am of the working assumption that any disabled parking is for the use of staff, patients or visitors. Ted, if I've got that wrong, I'm sorry if I cause a major parking crisis by saying that. So let's confirm that. And whilst I appreciate your focus on patients, then I think that would be my position. We, of course, have to ensure that we have accessible parking for colleagues with a disability, and I am sure that will be part of the car parking review that Ted is leading on. Thoughtful of your suggestion around behind AMH, just because that's obviously going to be demolished, so I'm not sure what the cost incurred, etc., of that would be, but Ted will be much better placed to answer that. So hopefully that answers your question, and I would suggest that you use the spaces that are available at the front.
Great. Okay, thanks, Caroline. I feel we've got through a lot of questions today, but there were a few others that we'll need to get back to people directly. So the list that Mike's given me, it's a Kylie McDonald, James Scott, Tanya Forbes, all asked about different aspects of overtime, regrading or pay. And Caroline, as always, will get a reply to you individually by email. Okay. So, Caroline, thanks again for your time. Anything you'd like to add before we finish?
No, I don't think so. It's always after these Q's and A's that we get the fallout of what I should and should not have said. So we'll wait and see. And anybody that I have offended or said the wrong thing, I apologise in advance. But the intention is right.
Yeah, no, that's great. Thanks, and we look forward to seeing you again on the 18th of May.
Super. Thanks, Stephen.
Great. Thanks, Caroline.